Most people believe that routine health checkups are essential as we age. They offer reassurance, early detection, and peace of mind, or so we're told. But what if I told you that after a certain age, some of these well-intentioned screenings could actually do more harm than good? It might sound strange, even reckless, but more and more seasoned doctors are beginning to acknowledge this uncomfortable truth. Especially for patients over 70, the medical community is starting to realize that one-size-fits-all testing can result in more harm than healing. This isn't about ignoring health. It's about respecting it in a smarter, more thoughtful way. Let's begin with one of the most trusted procedures out there, the colonoscopy. It's long been hailed as a gold standard for detecting colon cancer. But once you hit your 70s, and particularly if you've already had clean screenings in the past, this test can quietly cross a line from life-saving to potentially harmful. The risks become harder to ignore. The preparation alone, a powerful laxative that flushes out the digestive tract, is a harsh ordeal. In younger adults, it's uncomfortable. In seniors, it can be dangerous, leading to dehydration, disorientation, and falls. Add to that the anesthesia risks. Prolonged sedation in an aging body can trigger confusion, dizziness, even memory issues that linger. What's worse is the possibility of discovering benign growths, polyps that might never become cancerous, but now trigger a whole chain of procedures, biopsies, or even partial bowel removals. For someone in their 70s or 80s, the physical toll and stress of these follow-ups can deeply impact their quality of life. Take George, for example, a sharp 82-year-old who enjoyed daily walks and a full social calendar. He felt fine, had no symptoms, but agreed to a colonoscopy at his doctor's suggestion. During the prep, he became dangerously dehydrated. After the procedure, still groggy from sedation, he fell and fractured his hip. The scope found nothing unusual, but that one test led to months of rehabilitation, financial stress, and a steep decline in his energy and independence. George is not alone. His story is one that quietly echoes in hospitals and homes across the country. There are safer alternatives now. Non-invasive stool tests, for example, offer reliable screening with far fewer risks. They're simpler, gentler on the body, and effective at detecting warning signs. For seniors not experiencing symptoms and with a history of clean tests, saying no to a colonoscopy isn't neglect, it's wisdom. It's choosing to protect your well-being instead of being swept into a system that often equates more testing with better care, when that's no longer the case. Let's talk. The emotional cost of full-body scans is often overlooked. Seniors end up obsessing over things that aren't dangerous, consumed by what-ifs instead of enjoying the health they do have. These procedures are rarely covered by insurance either, meaning many pay out of pocket for what they think is peace of mind, only to find themselves caught in a cycle of stress, testing, and exhaustion. That's not prevention. That's anxiety disguised as medical care. Age demands a new approach. Instead of looking for problems that may never become real, we should focus on how we feel, how we live, and how we function. Your energy, mobility, clarity of thought, those are the markers that matter most. Listening to your body often tells you more than any machine can. And it's time we trust that. The same principle applies to another common procedure, the cardiac stress test. Often seen as a smart way to check for hidden heart disease, these treadmill or chemical stress tests are routine in adults over 70. But here's what most people don't realize. Those tests often deliver false positives in older bodies. As we age, it's normal for our arteries to stiffen, our heart rhythms to shift, and our recovery times to stretch. These are not always signs of disease, but the machines don't know that. They detect these changes and interpret them as problems, setting off more testing, more interventions, and sometimes even surgeries. The risks here are real. Angiograms, catheterizations, and stents all come with complications, bleeding, kidney damage, even stroke, and they're harder to recover from as we age. Let me tell you about Harold. He was 76, feeling fine, walking daily, no shortness of breath, no fatigue. His doctor recommended a stress test, just to be safe. It showed a small abnormality, leading to a catheterization, which found minor plaque. A stent was placed anyway. Shortly after, Harold developed complications from the blood thinners and ended up hospitalized with internal bleeding. 3 months of recovery followed, all from a test that wasn't necessary in the first place. And yet, we keep offering them. Why? Fear. Fear of missing something, of not catching a ticking time bomb. But we forget that the purpose of medicine isn't just to extend life. It's to improve it. If you're not having symptoms, if your heart isn't telling you there's a problem, it may be better to leave well enough alone. Aging isn't a disease. It's a stage of life that requires discernment and care. We can't apply the same rules to a 75-year-old body that we did at 50. We have to think differently. We have to act wisely. That doesn't mean ignoring signs or avoiding all medical care. It means choosing care that's appropriate, proportional, and aligned with your goals, not just the system's habits. Let's say this clearly. You are not safer just because you get more tests. Sometimes, the safest choice is not doing something. Not because you're afraid, but because you understand the real cost: physical, emotional, and financial. Tests should help you live better, not steal your time, energy, or peace of mind. If this message resonates with you, if it's made you pause and think differently about your health journey, I invite you to stay tuned for the second half. We'll explore more real-life examples and talk about the deeper questions we should be asking our doctors and ourselves. Not every test is a gift. Some are a burden wrapped in the illusion of safety. And at this point in life, your care should be about clarity, not confusion. Stay with us. As we continue this conversation about medical tests that may not serve seniors well, let's return to a procedure that still causes confusion and concern: routine colonoscopies. While this was touched on earlier, it's worth digging deeper because of how commonly this test is still recommended, even when the evidence tells us to be cautious. The issue isn't that colonoscopies are inherently dangerous. The older adults are particularly vulnerable to the side effects of both the preparation and the procedure itself. First, you have the prep, the infamous bowel cleanse that involves drinking a large volume of powerful laxatives over a short period of time. For younger folks, this is unpleasant. For seniors, especially those with heart conditions, kidney issues, or who take diuretics or other medications, this process can be a serious health risk. It flushes out not just waste, but crucial electrolytes that keep your heart and muscles functioning properly. And because many older people don't drink enough water to begin with, the dehydration that follows can be swift and severe. Some wind up dizzy, fainting, or worse, falling, injuring themselves in their own home before they ever make it to the clinic. Then there's the procedure itself. Colonoscopies require sedation, and while anesthesia is routine, it's far from risk-free in the elderly. Older adults metabolize sedatives more slowly. Their livers and kidneys work differently. Their brains are more sensitive. What might be a short-lived grogginess in someone 40 could become days or weeks of brain fog in someone 80. There's even a name for this: post-operative cognitive dysfunction. It doesn't happen to everyone, but when it does, it's alarming. Memory slips, confusion, difficulty concentrating, all after a procedure that might not have even been necessary. That brings us to the bigger picture, the reason for the test. Colonoscopies are designed to detect polyps, tiny growths in the lining of the colon. Some of these, if left alone for a decade or more, may turn into cancer. That's why they're useful in middle age. But for someone in their 70s or 80s, especially with previous clear tests, the math changes. Polyps grow slowly, often over 10 to 15 years. If you're already in your late 70s, and especially if you're otherwise healthy and asymptomatic, the chance of that polyp turning into something dangerous before something else in life takes priority is incredibly small. Meanwhile, the risk of complications, perforation, bleeding, adverse drug reactions keeps climbing with age. That risk-benefit balance is crucial. It's the difference between proactive care and overzealous intervention. Take the case of Eileen, a retired teacher in her late 70s. She was urged to get one last colonoscopy, even though her previous screenings had been perfectly clean. During the procedure, her colon was accidentally perforated, a rare but serious complication. She underwent emergency surgery, spent weeks in the hospital, and months regaining her strength. That single test cost her not just money, but mobility, energy, and confidence. And what did it find? Nothing that needed treatment. This kind of story isn't shared enough. The truth is, many people continue getting these tests out of fear. The fear of missing cancer. The fear of regret. But that fear needs to be balanced with wisdom. At a certain point, prevention becomes a diminishing return. And if we're not careful, the things we do to stay healthy become the very things that steal our health. So what should you do instead? First, focus on your symptoms. If you have changes in your bowel habits, blood in your stool, unexplained weight loss, or ongoing abdominal pain, absolutely get checked out. But if you're symptom-free, have a history of clean. When you put someone over 70 on a treadmill or inject a chemical to stress the heart, you're not just measuring fitness, you're probing for irregularities. The problem is, older hearts almost always show something unusual. That's just what happens with age. Slightly slower responses, minor blockages, variations in electrical signals. But those anomalies don't necessarily mean danger. Yet the test doesn't know that, and neither does the insurance system. So a small red flag leads to more tests. Angiograms, CT scans, maybe even a stent or bypass surgery. And each step brings risk. Contrast dye harming your kidneys, bleeding, infections, side effects from medication. It's a slippery slope, one that has caught many healthy seniors by surprise. What starts as a just-in-case test can spiral into months of procedures and setbacks, all for findings that might never have caused harm. That's why the American College of Cardiology and many geriatric care groups now discourage stress testing in older adults who aren't having symptoms. Not because heart disease isn't serious, but because the test doesn't always tell the truth and often creates problems where there were none. Instead, the better path is rooted in your daily habits. If you're walking, breathing easily, sleeping well, and living your life without fatigue or discomfort, that's meaningful data. That tells a far more accurate story than any treadmill machine. Of course, if you're experiencing symptoms, chest tightness, dizziness, shortness of breath, that's different. Those are real warning signs. In that case, testing is appropriate. But blindly screening healthy people in their 70s is not just wasteful, it's dangerous. This brings us to the broader truth. Aging demands discernment. It's not about giving up on your health. It's about claiming your health as your own. Not letting it be dictated by outdated checklists or the assumption that more care equals better care. It often doesn't. In fact, the best care after 70 is often less. Less poking, less prodding, fewer procedures, and more conversation, more listening, more attention to how you feel and how you want to live. Your time is precious. Your comfort is sacred. And your body deserves to be treated not as a project to fix, but as a partner to honor. That means saying no when the risks outweigh the rewards. That means understanding that some tests don't bring clarity, they bring chaos. And that sometimes doing nothing is not passive, it's powerful. If you've made it this far, if these words have sparked reflection or relief, then know you're not alone. Many seniors are waking up to the same realization. That health isn't measured by how many appointments you attend, but by how you move, feel, and connect each day. That wisdom isn't in the machines, it's in you. So take this knowledge with you. Ask your doctor not just, should I get this test, but what happens if I don't? Ask whether the outcome will truly change your life or just complicate it. And most importantly, remind yourself that choosing peace over panic, quality over quantity, and presence over procedures is not neglect, it's self-respect. You've earned the right to live on your terms, not in fear of what might happen, but in gratitude for what already is. Thank you for being here with us. If this video resonated, we'd love to hear your thoughts. Leave a comment with one insight you'll carry forward, and let us know how it's shaped your perspective. Your stories and your presence help others find clarity too. Until next time, stay informed, stay strong, and above all, stay well.